Fairburn Medical Products. This is a quick PowerPoint to discuss the Airrapy advantages. First, you'll see in the construction, we created a mattress made of non-porous, non-absorbent material, which is superior for disinfection and cleaning, which allows spray no wipe cleaning programs. The mattress can actually be disinfected while still on the bed frame. And we have translucent air cells, so you can visually inspect the inside of those cells for mold and mildew, which is common in air mattresses that circulate room air that has humidity in it. This gives you a snapshot of some of the accessories. The maroon blanket up there has a zipper on the inside. You can unzip and slide in a heated blanket to radiate warm air down, or it can just be used as a regular low air loss blanket, providing 360 degrees of low air loss therapy. You can also see some of the AirPods and positioning wedges that come with the Airrapy system. Cellulitis is very common within the U.S. market. One way to alleviate the pain and some of the heat associated with cellulitis is the utilization of an Airrapy disposable pillow. Works very, very well to envelop that leg down into it so there's less pain, there's no pressure, and it does a great job of removing that heat. Same thing with a patient suffering from edema. It works very, very well to support the legs, to elevate the legs, but at the same time reducing temperature, eliminating moisture. This is one of the more popular AirPods. It's for a contracture of the hand. You can slide the deflated AirPod into the hand, plug it into the bed, it then inflates and provides continuous passive therapy for that hand to open back up. Same thing with the lower extremity contracture. You can put the deflated pillow between the legs, inflate it, it's going to fill that gap. You can punch other holes into the pillow to direct more air in certain areas, let's say incontinence, which works very, very well. This was a great finding that we found by designing the circular cylinder wedge. Whenever we put that wedge in the bend of the knees, it elevates or tilts the pelvic up and away from the bed and pulls the femur forward, and it relieves back pain, which is very, very common with folks who are in low air loss or alternating pressure beds. It also does a great job of reducing the pressure even further at the coccyx area by lifting that pelvic up and away from the bed. This is a large Panas. We do have Panas pillows that can be applied between the Panas and the legs. They will inflate, lift that Panas up, and allow air to get in there and allow for catheterization or for a nurse to be able to treat that area. Skin folds, very common in the bariatric market. With our Airrapy product, we can manage those skin folds through a couple of the AirPods that you see here. By lifting that fold, inserting an AirPod and inflating it, we're then removing skin-to-skin friction and contact and pressure. We're eliminating heat and we're eliminating moisture. So a much better way to manage those tears that are associated with skin folds. This demonstrates or shows some of the common issues when you're dealing with products that are made cheaply. If you look at the first two slides, we poured water on that area, let it pool, let it sit. Within 4 minutes, 4 or 5 minutes, it had entered the inside of the mattress because that cheap cloth fabric just doesn't hold up. The polyvinyl that we used, the 2 layers welded together and sewn together, we did the same thing. I added coffee grounds to the water so that you could actually see the area where the water was, but even after an hour and 20 minutes, no water had entered the inside of the mattress. Again, better materials gives you a better product. We do not use Velcro to hold our air cells in. That's an infection control nightmare. It also becomes very weak after time. We do not use the little silver, what we refer to as blue jean snaps, because they rust, they come undone. The air cell then falls over on its side and it becomes a slide out of the bed. We use the plastic directional snaps that are very strong, very powerful, will not come undone until you point the arrows up, seen here, and then you can unsnap it and pull it away. It makes a cleaner, stronger bond. Here we discussed a while ago the problem with fluids getting inside the mattress. Another common problem is the black hides things. It hides blood, urine, body fluids, other things. And housekeeping doesn't see it, they don't clean it. Here we mark the bottom of an Airrapy mattress with a green, yellow, and black marker. We did the same thing with the black cloth bottom, and you can see it was absorbed into the mattress, which is something you never want to happen. Aromatherapy is one of our new ventures. We're very excited about it. We've created an air pod that you plug into the bed that has essential oils into it. And once it's plugged in, it pushes that odor throughout the room. A recent Vanderbilt study showed some huge benefits. It lowered work stress from 41 to 3%. It reduced the feelings of being overwhelmed from 25 to 2. It increased staff's feelings about being able to handle the workload or the stress from 13 to 58, and it increased the optimal energy level from 33 to 77. Well, if it's doing that for your staff, I can imagine what it's doing for your patient population. We are currently working on a UV disinfection project. We hope to have this completed by second quarter of 2018. More to come on that. And we have a full line of bariatric beds that are in part of our bariatric rental program, but we also sell these bed frames. Very, very proud of the bed frames. They're as high-end as any other frame on the market. So please feel free to contact us about your bariatric needs. Fairburn Medical Products, thank you.